Tonight, a prominent Virginia state senator stabbed by his own son.
Gus Deeds did not have a previous criminal record in Bath County, but now it appears he did have mental health issues, and he apparently knew it.
Yeah, so according to the Richmond Times-Dispatch, he sought mental health services as recently as yesterday. WUSA 9's Mola Lengi has been looking into this for us. It's crazy to think about that. Just yesterday, he was looking into the day before.
It was that soon. You know, it appears that while Deeds was evaluated at a mental health facility, he may have subsequently been turned away. Now, this brings to light a harsh report on mental health services in Virginia.
To qualify for a temporary detention order at a mental health facility, the Virginia Code of Law says there must be a, quote, substantial likelihood in the near future that a person is at risk for serious harm to himself or others and be in need of hospitalization or treatment. The Richmond Times-Dispatch reports that Gus Deeds underwent an emergency mental health evaluation yesterday, but was turned away due to a lack of available beds in Western Virginia. Although this evening, the Western State Hospital in Western Virginia said it had openings, but received no calls. Why Deeds did not receive necessary treatment remains unclear, but it might highlight another breakdown in the state mental health service. In 2012, the Virginia Inspector General conducted a report about the state's failures that, quote, place individuals, their families, and the community at risk. In a 90-day period, 72 people who should have been admitted for treatment were turned away due to a lack of beds.
It's very difficult to know, and timing is critical. Certainly, if you know that there's any history of any possibility, it's important to have ongoing mental health care so that there's more than just the family involved, that there are other people, professionals, a support system.
The report blames fewer available resources to help those in need over the last decade. The Inspector General also takes aim at medical screening and assessment, saying it can be inefficient and at times wrong, and that in some cases, screeners lack the proper authority to admit people who face mental health crisis to a facility.